Our first 50 years have been marked with triumph, tragedy, and momentous gains for nurses and healthcare professionals across Ontario. We've seen mounting success in the courts, improvements in workplace legislation, increased wages, and vital mental health coverage for our members. We've grown into a fierce, bold union of nurses and healthcare professionals, the largest in Canada. But our success has not been easily won. In 2005, ONA member Lori DuPont is bullied, harassed, and murdered at a Windsor hospital by a colleague doctor. The crime sends shockwaves and anger throughout the province. And for 5 long years, ONA lobbies changes to the Occupational Health and Safety Act. In 2010, Bill 168, also known as Lori's Law, is passed, protecting workers from violence and harassment in the workplace. In 2016, Ontario passes legislation allowing first responders access to treatment for PTSD, but not nurses. ONA steps up, partners with labor unions, and successfully lobbies the government. In 2019, the Ford government takes aim at nurses again. Bill 124 caps public service wage increases, and nurses and healthcare professionals are hit hard. ONA files a charter challenge as a devastating respiratory virus begins to sweep the globe. The legislation fuels nursing shortages and burnout as Ontario's healthcare system buckles under the pressure.
Enough is enough.
By the time Bill 124 is overturned 3 years later, the damage is catastrophic. As COVID-19 deals a deadly hand to thousands of Ontarians, nurses and healthcare professionals struggle to protect themselves. ONA takes a stand against employers, demanding better access to PPE, improved working conditions, and better mental health support. But wave after pandemic wave takes its toll. Across Ontario's neglected long-term care system, the situation rapidly worsens. Our members sound the alarm. Media coverage of horrific conditions spark outrage. And when the government launches its Long-Term Care Commission, ONA has a big role to play. ONA testimony points to widespread systemic failures and heartbreaking personal accounts. The final commission report echoes ONA's demands. Fewer studies, more funding, more action. Our tenacity during the COVID-19 crisis continues to drive better collective agreements and more equitable employment contracts for our members. During hospital sector negotiations, members and their dependents receive unlimited mental health coverage. A huge victory and an exceptional benefit stemming from unprecedented times. Since 1973, ONA membership has grown to more than 68,000 nurses and healthcare professionals. Since 2008, more than 18,000 student affiliates have joined our ranks. In recent decades, ONA members have stood courageously against unfair and disrespectful contracts. In 2012, Haldimand Norfolk public health nurses walk out. After several days on the picket lines, they win a contract that reflects their dedication in the community. In 2015, Thousands of ONA members working at community care access centers walk bitterly cold picket lines during the first mass strike in decades. After almost 3 weeks, ONA nurses win a precedent-setting arbitration award. In 2018, after 2 years working without a contract, Thunder Bay Public Health nurses, the lowest paid in Ontario, go on strike. Their demand for equity and respect finally earns them a fair contract. Less than a year later, 80 Windsor Region public health nurses are forced to strike when their employer refuses to negotiate a fair agreement. These dedicated nurses organize community events to support their community as they picket, including a blood donation drive. In 2021, ONA launches its first strategic plan to guide our work and keep us focused on what matters: the leadership of our union and the delivery of the highest quality public health care. In 2022, ONA tables an ambitious anti-racism and anti-oppression plan to drive lasting positive change within our ranks. Every ONA member has the right to equal treatment and freedom from discrimination and harassment in the workplace and the union. For more than 50 years, ONA members have taken a stand against injustice. We've educated the public, rallied the media, partnered with labor, and drove lasting historic change for the women of Ontario. We've navigated a global pandemic where everyday actions of nurses and healthcare professionals saved countless human lives. We've held marches, called MPPs, and raised our voices against harmful legislation and the systematic dismantling of public healthcare in this province. Local action is our action. The last 50 years, we proved that. As we continue our fight, it will be known across Ontario. The nurses are coming.